Madam Speaker, 57 years ago this week, President Lyndon B. Johnson signed into law the Medicare and Medicaid Act. By increasing health care across access for elderly and low-income Americans, this act was a giant leap forward in building a more perfect union. Today, nearly 64 million Americans are enrolled in Medicare, and over 83 million Americans receive assistance from Medicaid. We know that these programs are highly effective. Extensive research shows that Medicaid coverage is associated with a range of positive health outcomes. Medicare and Medicaid saves lives. Medicare and Medicaid also has considerable economic benefits. Medicaid significantly helps reduce poverty and has been tied to economic mobility across generations and higher educational attainment, income, and taxes paid. Despite the benefits of Medicare and Medicaid, my Republican colleagues are trying to dismantle these programs. In 2018, a House Republican budget proposal slashing $537 million from Medicare over a decade. Yet while House Republicans try to gut Medicare and Medicaid, House Democrats are working to expand these programs to more Americans. I'm fighting particularly hard to improve Medicare and Medicaid in my district of the Virgin Islands of the United States and to the other U.S. territories which have long suffered health care inequities. Before 2017, in the Virgin Islands, nearly 30% of residents didn't have health insurance. This is a rate disproportionately higher than the national average of approximately 9%. As of 2021, 34,000 individuals in the Virgin Islands, over a third of our population, relied on Medicaid and CHIP. However, the Virgin Islands has historically been denied the same Medicare and Medicaid benefits available to the states. Unlike the states, federal Medicaid funding to the Virgin Islands is capped. And before the storms of 2017, the federal government covered just 55% of Medicaid costs of the Virgin Islands, which is substantially lower than the 83% that would have been covered if the Virgin Islands were treated as a state. In addition, the Virgin Islands and U.S. territories are excluded from receiving low-income subsidies under the Medicare prescription drug benefit, and they are excluded from DSH, the disproportionate share hospital program under both Medicaid and Medicare. Through recent legislation, I worked to temporarily increase the federal share of Medicaid funding to the Virgin Islands from 55% to 83%, and increase federal Medicaid funding to the Virgin Islands by hundreds of millions of dollars. This has allowed 20,000 of our most vulnerable Virgin Islanders to retain access to health care. Unfortunately, these provisions are only temporary, and a permanent solution is needed to ensure the people of the Virgin Islands have access to affordable health care. That's why I introduced H.R. 3434 with representatives from the other territories. This bill would eliminate the unfair Medicaid funding limits for U.S. territories, increase Medicare reimbursement to hospitals in the U.S. territories, and allow residents of the U.S. territories to be eligible for low-income subsidies under the Medicare prescription drug benefit, permit the DSH payments to U.S. territories, and take other measures to improve access to health insurance. I'm calling on the Senate to address the Medicaid issue for the Virgin Islands, for Puerto Rico, Guam, Northern Marianas, American Samoa, to help almost hundreds of thousands of Americans. I'm calling on the Senate to address this in any healthcare reconciliation bill with what was passed for the territories here in the House. When President Lyndon B. Johnson signed the Medicare and Medicaid Act into law, he promised no longer will older Americans be denied the healing miracle of modern medicine. No longer will young families see their incomes and their hopes eaten away simply because they are carrying out their deep moral obligations to their parents, to their uncles, and to their aunts. Unfortunately, this promise has yet to be fulfilled to residents of the Virgin Islands and the U.S. territories. As we mark 57 years of this legislation, let us commit to fully realizing this hope by expanding access to Medicare and Medicaid to all Americans. I yield back.